Hello everyone, this is Dr. Rashid and today I'll be talking about blood glucose levels and diabetes. The glucose in our blood tends to stay normal. This is because of two things: the diet that we eat and the insulin present in our body. Then there comes a time when the glucose in our blood increases. This is known as hyperglycemia. This is mainly because of the failure of insulin to work properly. This happens because of three reasons. The first is either the insulin is not being produced at all, or the produced amount is not enough for the body. And the last reason is that insulin is not able to perform its action. In type 1 diabetes, insulin is not produced at all. This starts at a very early age, about 10 to 13 years, and it is an autoimmune disorder which destroys all the cells where the insulin is being created in the pancreas. And then this happens in type 2 diabetes, which occurs at an age of more than 30 years. Type 1 diabetes is also called insulin dependent diabetes, whereas type 2 is known as non-insulin dependent diabetes. The sign and symptoms of type 1 diabetes is polyuria, which is frequent urination, thirst, weight loss, blurred vision, paresthesia, and ketoacidosis. The sign and symptoms of type 2 diabetes are lack of energy, delayed wound healing, visual blurring, and increased amount of infections in the body. Now I'll tell you the criteria for labeling someone as diabetic. There are three states in which we measure the blood sugar. First is the fasting state, in which the patient does not eat or drink anything for 8 hours. Then there is 2 hours after glucose intake, and then comes random, which means we take the blood at a random any time of the day. Less than 110 in the fasting state and less than 140 after glucose intake is considered as normal. But if these values are increased more than 126 in fasting or more than 200 after consuming of glucose, then it is considered as diabetic. There are certain ways we can investigate the blood sugar of a patient. First is fasting blood sugar, then is random blood sugar, then there is oral glucose tolerance test, in which we keep the patient fasting for 8 hours and then a 250 ml of glucose water is given to him, and then after 2 hours the blood glucose is again tested. This is oral glucose tolerance test, and the last test is HbA1c. This is a laboratory investigation. And now the treatment. The treatment for type 1 diabetes is diet therapy as well as insulin for life. For type 2 diabetes, according to the severity, the treatment is decided. In the very initial stage, diet alone can be the treatment for diabetes, but as it progresses, diet plus oral hypoglycemic drugs are used, and if the condition does not get any better, then insulin is added along with diet therapy and oral hypoglycemic drugs. The oral hypoglycemic drugs comes in three classes. The first is sulfonylurea, which comes with a brand name of Emeril. Then comes bigonides, which is known as glucophage, and then alpha glucosidase inhibitors, which is also known as by its trade name glucobe. Insulin is used in type 1 patients as well as type 2 patients who fail to respond to diet therapy and oral hypoglycemic drugs. Insulin is available of four types. First is ultra short acting. It has an onset of 20 minutes and it has a duration of action for about 3 to 4 hours. Then comes short acting, which has 30 minutes of onset and it lasts for up to 6 hours. Then intermediate, which starts its onset on about 2 hours, which has a duration of action for about 18 to 24 hours. Long acting is given twice daily, and it is usually used in combination with other types of insulin, such as short acting or ultra short acting. Now I'll tell you about hypoglycemia. Hypoglycemia is a condition in which the sugar level or the blood glucose levels falls below the normal level of our body. This may be due to low glucose intake or extreme high doses of oral hypoglycemic drugs. The signs and symptoms of hypoglycemia may be sweating, trembling, hunger, anxiety, confusion, drowsiness, nausea, or even unconsciousness, which is very common to happen. The treatment of hypoglycemia is also very easy. If the patient is conscious, he should be given any kind of sweets which contain glucose, or a simple juice should be given to him. If the patient is unconscious, 50 ml 50% dextrose water should be given through intravenous route, or the other option we have is 1 milligram of glucagon should be given intramuscularly. Diabetic ketoacidosis is a medical emergency. It is the complete opposite of hypoglycemia, in which there is constant hyperglycemia, which means increased levels of sugar in the blood. It is mainly due to three reasons. It may be because any kind of infection in the body. It may be due to stopping or reduce the insulin dosage of a patient. And unfortunately, all new patients of type 1 diabetes are diagnosed this way. Ketoacidosis is diagnosed with an increased level of blood sugar more than 250 ml per deciliter constantly. The clinical features includes intense thirst, nausea, polyuria, vomiting, abdominal pain, dry tongue, rapid weak pulse, and fruity breath, which is due to acetone. The management, however, is very different. The patient may be given fluid replacements, regular insulin, which may be given through intravenous route or intramuscular route, and potassium replacements. The patient may also be given antibiotics in case of any infections. Coming back to the complications of diabetes, the infections may be on the skin, urinary tract, or it may be in the lungs. Along that, there are vascular disorders as well, which may be large vessels or in the small vessels. In large vessels, there may be atherosclerosis, stroke, myocardial infarction, or foot gangrene. Small vessels disorders includes diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. I hope this made it easier for you to understand the blood glucose levels and diabetes. This is Dr. Rashid. Thank you.